Currently at Hospital University of Pennsylvania, we are in several buildings. We're designing a hospital for the future, the pavilion at Penn Medicine. This is a way for us to move into the future with our patient care and also with our clinical care. Soon, we're going to have this amazing facility to continue our legacy of excellence in clinical care for many generations to come.
We wanted this hospital to be a hospital that would be at the forefront of medicine for the next 100 years and had the flexibility in its design and construction so that as technology changes, as medical practices change, the building could adjust to those changes.
The planning is probably 75% here. Planning here really centered around the big room concept. What that basically is in an IPD environment, pulling all the parties together, collaborating in an environment side by side.
Recognized technology, integration, collaboration. Schneider's been involved in this project as a partner.
Minutes time will be starting. Uh, Warm welcome to all the ladies and gentlemen present, and maybe appropriately in Chennai, I should say Vanakkam. Warm welcome again to the 7th edition of APAC HealthTech Innovation Conclave. This is the 7th edition, and we are doing it first time in Chennai. We have done this in other cities, including Delhi, Mumbai, and the likes. And now we are coming to Chennai, which has been at the forefront of the healthcare advancements and healthcare revolution in the country, and has been a pioneer in sort of building the roadmap for the healthcare sector across India. Before we delve deeper into the conclave, perhaps it would be pertinent to mention a little about APAC Network, who is organizing this HealthTech Innovation Conclave. And as I mentioned already, it's into the 7th edition. So APAC News Network is a community building, knowledge sharing kind of platform, and obviously a knowledge media organization. We have a pan-India presence and also beyond Indian shores across regions of Asia. We primarily focus on technology deployments across various sectors. Healthcare is one of the primary sectors where we focus. In addition, we focus deeply into governance, especially on the policy level, things that are happening. We focus deeply on education, on BFSI, on manufacturing and the likes. And primarily, we look at it from a holistic 360-degree aspect, not only how technology is deployment, but how that technology deployment impacts policy, and accordingly the future roadmap of that particular sector. Maybe a few about I would request on APAC that would give a clearer picture of the 360-degree offering across various platforms that we provide on these sectors. Thank you. Coming back to the 7th edition of the APAC Health Innovation Summit happening today, conjunction with Schneider Electric, and all of you would be aware that Schneider is a global pioneer in technology solutions, and especially on building infrastructure solutions that are sustainable, resilient, and safe. Attributes which are particularly relevant for the healthcare industry, hospitals. When we're talking about digital hospitals of the future, they need to have all those attributes. They need to be safe, they need to be resilient, they need to be sustainable, and Schneider will be globally perhaps the most trustworthy name who can hospitals in that journey, that endeavor. So during today's discussion, we have a large number of hospitals, both from the public and private sector. We have eminent gentlemen from the public sphere, the policymakers, who would talk about the policy direction of healthcare and how technology innovation is catalyzing the transformation of those innovations in this particular sector. And last but not the least, we have to, as I mentioned in the beginning, Tamil Nadu and Chennai in particular has been unofficially the medical capital of the country, and has already been playing a pioneering role in healthcare advancements. So when we are talking about technology transformation across the healthcare sector, Chennai and Tamil Nadu cannot be far behind, and I'm sure over the next few hours we would hear about some of those advancements, some of those best practices, which can be better emulated uh, in future uh, by all of you, and the actual success of the conference today would be measured by what are those some of those best practices that you can replicate in your organization when you go back. So without further ado, I would like to request the speakers for the inaugural session to come on stage. May I first request Dr. Gerard Maria Selvam, Additional Director, National Health Mission, Government of Tamil Nadu, to come on stage. Thank you, sir. Next, I would request Dr. Hirian Ravi Kumar, Joint Director, Tamil Nadu Urban Healthcare Project. Dr. Ravi. I would now request Sweta Sharma, Segment Head, Building Schneider Electric, to come and join us on the stage for the. May I also request Nikhil Kumar, Head Healthcare Segment, Greater India Operations, Schneider, come on. May I now request Ms. Sanghamitra Mohanty and Mr. Gopi Krishna Arora, co-founders and directors of APAC News Network, to welcome our eminent guests with small token of appreciation. Can we? May I now request Mr. Nikhil Kumar, Head Healthcare Segment, Greater India Operation, to give his perspective on the innovations that Schneider has been particularly undertaking for the healthcare sector.
Thank you, distinguished guests. Welcome to this forum. This is all important forum, and I could see some known faces also on this platform, which is very welcoming because this fraternity is growing day by day. And on healthcare front, especially, we need to have some very focused approach. And all these zones, we call it as a very hypersensitive zones. So we need to have a very focused approach to this segment. And I'm very happy and I welcome you all for this small deliberation which we are having in Chennai. So I'll take few minutes. I'm Nikhil Kumar and I'm heading the healthcare segment for Greater India Zone for Schneider Electric. So, few aspects which are already spoken, which are becoming buzzwords also for us. The resiliency factor, the efficiency factor, what we are looking in our technology uh, has to make things on a faster pace. This is what the bottom line is. So, our goal is that life is on for us, and when it is energized and it is efficient and connected. So I'll quickly move for more care centricity and resiliency, our next slide. So this is a little energy landscape what we have. So energy consumption will grow by 50% in few years, and due to mega trends which we see are happening, and efficiency has to improve 3 times. So it's not double, but it's 3 times what we have to do, and we have to do it quickly, and we have to have some collective action planning for this. So I'm happy that all the government officials are also there, and they are doing lot of things which inculcates to improving this infrastructural things which are there in the healthcare segment. So today we'll discuss how, in context of hospitals, we as Schneider Electric make safe and reliable, efficient infrastructure for healthcare. So if we see, we are looking at a very extraordinary situations all across the globe, so to speak, and India is part of it. So it is affecting the patient care, the caregiver who is coming to the healthcare. So it is essential to make things predictable and more planned, rather just going and reacting to those situations, the crisis situations. We have to plan accordingly for all the unparalleled events which are happening. So I'm very confident that most of us uh, in this conference hall will relate to this and agree to this, that healthcare being a very regulated endeavor, so we need to have many unique challenges which are coming on the geographical part, the cultural part, and we need to look into those challenges. And issues which are highlighted here, like workforce shortages, broken supply chains which are happening, then the economic turmoil which is happening. So these are very important aspects which we face in today's environment. So this is making us more crisis driven rather than making it on a predictive front. So healthcare system, we can say, is facing with a tsunami of all these things which are happening all around. So these are few facts and figures which we see as trends, which I have already spoken. So we can relate to all these data points which are there. So future healthcare will have to shape up accordingly, looking all these trends and shapes, and be it aging population, which will require a robust health services. Cyber security is one very important point. Then we have net zero ambitions and patient centricity at the core of all these systems. So what is the solution? So either we need to have a connected system all across, which has interoperability, because we have some modernizations to be done to the existing infrastructure. So we need to connect, collect, analyze, and take actions accordingly. But this is not the mantra. So what is the mantra? So mantra for us will be the digitization, because digital activities have to be done and have to be done very on a very faster pace. So it is possible by connecting all the assets and get the information with total analysis and then make the insights out of those analysis. So yes, a new way thinking is required, and each one in this August gathering should be involved in that journey to achieve what we call as a smart hospital or a smart healthcare system. So the endeavor is that we bring it on a fast track. So as Schneider, we partner for healthcare organizations to design and deliver digital solutions that are ready for today and flexible for tomorrow, and make it more resilient, care-centric, efficient, and sustainable. I'll go much wider on the scope that what we do. So end-to-end digitization is the platform what we create, right from this is just one example, right from the car parking to the operation theater. We have channelized all the integration of the data which we can gather out of it. So all the assets, energy or energy management, the building management systems, the power management, the clinical requirements, so that we have a integrated software, and that we call it as a EcoStructure software. So as Schneider encompasses best and proven state-of-art solutions for digital hospitals, enabling all the assets on one platform seamlessly. So this eco structure, which brings robust digital transformation to our customers, empowering them with extraordinary healthcare facilities. So a little bit on the eco structure front. So we are manufacturing all the uh, uh, connected products which you see on the screen, right from the transformer, substation, microgrid to the readily available switches. So we have all the solutions which are connected on a network, and then all the data is collected on the edge layer, and we have ample of solutions, softwares, which enables that data for some actionable insights. So this is a total platform what we have, and then we have a consultancy at the third layer, which is very important and which requires a lot of you can say insight data. So we give those on the third layer, which is the advisory layer. So this is a IoT enabled platform of EcoStructure. So these are the 10 important solutions which we are integrating right from the critical assets till the electrification and digitalization of the total building. So these are the 10 all electric and Hospital is the line what we use for this. So this 10 solutions provide the futuristic or the smart hospital. So a little bit on the integrated management side. So we have a very, very robust and very state-of-art software which is made especially for the healthcare segment, which is building operations software. So it is an open platform software which gives you the monitoring total and the management part of the building operations. So no silo working is required. It gives the total interoperability and the integration of the total building assets in one solution. So now going that the changing world is enormous with which requires safeguard of patients, staff, and financial health. So here to mention few of the points which is really needs a consistency. So we have the protections which gives you the fire safety, which happens due to some circuit problems or some short circuits which happens due to the overload conditions. Then we have a continuous thermal monitoring sensors together with arc flash protections. Then we have a very specialized operation theater panel, which is especially for the hypersensitive zones, and it safeguards from all the safeguards from all the uh, faults which are taking care inside that hypersensitive zone. So we feel that the patient is safe as well as the staff and the doctors are safe inside that hypersensitive zone. Then talking about some power quality issues, because this is what is coming up on day to day whenever we visit any hospital site, that there are some arc flashes, there are some transients which comes in the system and it destroys or it gives some conking effect on very expensive equipments which are there in a hospital. So we have very robust power quality gadgets which transforms and which shields your environment, your gadgets, your equipments from all the power quality problems. So fire, thermal monitoring, then arc flash, then operation theater panels. So these are all the safety systems which we have in our basket. So few demonstrations are also there outside the hall. So during the breaks, we will be discussing more on that. So that will be more on the energy management side, then power management side, then building operations. Then we have the eco-structure solutions which are there. So we can have a deep dive on that. So let's take a second to absorb the untimely incidents that occurred as mentioned in slide. So at that time, we require a certified software to translate unexpected events which has happened and resulted in a downtime. So that requires a very say fulfilled uh, power recorder which we have, and it ensures that preventive approach is maintained rather than going in a crisis situation, and we can work on the actionable insights. So for this, we have our energy management system to provide that accountability in the processes, along with proper reporting and making efficiency levels to a different level for the assets, and also captures the financial losses which are happening, and it gives that uh, say cushion to work on the finances also. So those discrepancies can be eliminated through all these systems which we are talking. So few last two, three slides only from my side. So you cannot manage what you cannot see. So that's the sentence which is very close to me, because we need to have some certifications, some solutions which are certified and can provide you not going for a sleepless nights. So we are there for that. We have ample of solutions. So these are the footprints, and around 4,000 plus hospitals we have our touch base. We are powered by Schneider Electric, and around 10 plus chain of hospitals which are doing work in India as well as globally are part of Schneider legacy. So, hospital of the future is here, and let's build it together. And this is these are the real pictures of some of the hospitals are around the globe. And why not? We can also provide these hospitals to our patients and our customers in India as well. Thank you so much for your patient hearing.
Thank you, Nikhil. Before we go to the next speaker, it would be our privilege to welcome Mr. Rahul Talwar, Global Segment Leader, Healthcare, Schneider Electric. If, Rahul, you can be here. And may I request Gopi Krishna Arora, co-founder and director of APAC News Network, to welcome Rahul here. Thanks, Rahul. You can perhaps take your seat there. Okay. For our next session, and we would like to come on the policy level, what is happening, especially regarding innovations in healthcare. And who best to speak than Dr. Hirian Ravi Kumar, Joint Director, Tamil Nadu Urban Healthcare Project, to speak on the measures and initiatives undertaken, and what role innovations have played there. Over to you, Dr.
Morning to one and all. I first of all thank the organizers of this event for giving me an opportunity to throw some light on the technological innovations and good practices being carried out in the Department of Health. With respect to Tamil Nadu Health System projects, which I am representing on behalf of my project director, I am Dr. Ravi Kumar, Joint Director of Health Services of TNHSRP. So, this Tamil Nadu Health System project is a project being implemented by Tamil Nadu government with financing from externally aided through World Bank and also JICA, Japanese International Collaboration Agency. This Tamil Nadu Health System reform project is a policy maker, and it prepares proposals and sends it to the government, and it is involved in implementation of these proposals across the state in all the primary, secondary, tertiary care health systems of the state. So, some of the programs and projects which are being implemented, one of the major one is the comprehensive Chief Minister's Health Insurance Scheme. You all know that the Tamil Nadu government is a pioneer in health insurance for its population. This integrated health insurance scheme, which has been integrated now with the Prime Minister's Jan Arogya Yojana, PMJ, covers around 1 crore 43 lakh population of Tamil Nadu, and 1,829 government and private hospitals throughout the state have been empaneled for this insurance program, and 1,513 packages for different kinds of ailments are being covered under this scheme. And you will all be surprised to note that The premium is only 849 rupees per family for this insurance program, and the total outlay for the government for an year is 1,200 crores. And the coverage is 5 lakhs per family per year. So this is being implemented through the United India Insurance Corporation of Tamil Nadu, and it is being implemented through third-party mediators. And this is the whole process of online registration for this ID creation, ABA ID creation, and card generation, and, all pre-authorization submission, and all these claims are being done on an online platform, and all the beneficiaries are getting their uh, insurance claims within time. So this is one of the major flagship programs of the government. The next one is the EMRI services or the 108 program. This here also Tamil Nadu is a pioneering state where we have provided emergency resuscitation services to all accident victims. Today, road traffic accidents are a major cause of death in Tamil Nadu. As we all know, that Tamil Nadu stands second in the number of deaths due to number of accidents. But since the inception of this Trauma and Accident Care Emergency Initiative, TAI initiative, even though the accidents continue to stay as the second all in Tamil Nadu, the deaths have come down significantly. And we have a robust network of around 1,300 ambulances all over the state, which are strategically placed at all hotspots which have been identified along with the transport department and the highways department. And these ambulances, there are different types of advanced life support ambulances which contain ventilatory support, basic life support ambulances. We also have neonatal advanced life support ambulances, and we also have EAP ambulances. And in places where the regular vehicles are not able to go, we also have bike ambulances and auto ambulances which have been introduced recently. And these cater to the needs of all the variety of patients, including accidents, pregnancies, delivery cases also. And this also, there is also a free hearse system wherein dead bodies are being transported to the places of the individuals free of cost all over Tamil Nadu. And there are also 102 system where all the pregnant women and the persons requiring family welfare services are being transported to the hospital and back to their homes free of cost in Tamil Nadu. And this one important thing I would like to highlight in this trauma care system is there is a online platform. There is a real-time data login and data management. It's called trauma registry in all government hospitals across Tamil Nadu, wherein the data from the time of the accident till the patient is discharged from the hospital or he becomes dead is being monitored online. And there is a system called as pre-arrival intimation, wherein at the when an accident happens, the first information goes to the 108 and the call center manages the information, and it deploys the strategic ambulance located to the spot, and immediately a pre-arrival intimation is sent to the hospital, which is the nearmost where the patient will be transferred, so that the hospital which is going to receive the patient will be prepared with all paraphernalia and instruments, equipments, and every theater required to treat the patients, even in case of mass accidents and mass casualties. So, and now one more thing is this trauma registry has been integrated with IRATS, Integrated Road Accident Database of the Ministry of Road Transport and Highways, so that at the click of a mouse, we can get all the details from the wound certificate to the discharge certificate to the death certificate and treatment particulars, case discharge summary of the patient by a click of the mouse. So it is a technology innovation that has been carried out now. And one more important thing, as our Prime Minister has already mentioned, that the health of the people is based on the mental health of the people. So mental health problems become a major part of health burden of India. So the Tamil Nadu government has come up with new initiatives in this regard. We have a separate telemanas uh, toll-free number 14416, which caters to all the suicide cases or persons with suicide tendencies and persons having mental problems. They are being counseled through a toll-free number, and the intended suicide cases are being followed up for at least 6 months with frequent phone calls to assess their status and their mentality. And there is a Nalam 365 YouTube portal which disseminates information through the public health department to all the public through a YouTube channel. Various social and messages, health messages are given through this by psychiatrists, psychologists, and social workers. And some of the major initiatives and good practices being carried out by the Tamil Nadu Health System Reform Project covers areas like quality services provision, trauma care, non-communicable diseases, reproductive and child health care services, operational research programs, Tamil Nadu quality enhanced structural training programs, population health registry, and health assemblies. So I would like to touch on this briefly. Quality means we want to enhance the quality of all the primary, secondary, and tertiary care hospitals in the state, so that as our father of the nation, Mahatma Gandhi, said that patient is a consumer for us. So our aim is to provide services to satisfy the consumer. So the quality, as far as Tamil Nadu is concerned, the medical colleges are being prepared for NABH accreditation, and all the other institutions, including primary health centers, are being prepared for National Quality Assurance Standards certification. So there is a set of standards. There are set of procedures involved, wherein first state level assessment takes place and national level assessment takes place, and the center is certified as a quality assured center. Most of our government hospitals, medical colleges are moving for NABH accreditation. Two or three of them have got it already, and most of our headquarters hospitals and secondary care hospitals have been quality certified. And here the patient safety is an important factor involved. Infection control, patient safety, and feedback from the patients to give them more better. And here a dashboard has been evolved, wherein the all the particulars about the hospital and the quality services offered are being monitored by a dashboard online platform. And second thing is trauma care. As I already told you, trauma is being major death factor in Tamil Nadu. The trauma registry is an online portal. Previously, the casualty department where the accident cases were being dealt with was a chaos because there was no proper system of management of cases in the casualty. So if a mass emergency happens, everything would be in turmoil. But now, since this TIE initiative has been developed, Tamil Nadu has a three-tier system consisting of TIE 1, TIE 2, and TIE 3. TIE 1 is major medical colleges where there will be 24-hour services available of orthosurgeons, neurosurgeons, anesthetists, and higher multi-specialties, which will be available 24 into 7. That is TIE level 1. The TIE level 2 is this, all these specialists will be available on a call basis. They won't be available on a 24-hour basis. They'll be available on a call basis, and they'll be called in whenever necessary. And TIE level 3 centers are mainly referral centers where initially the patient is admitted to the hospital and they're being taken care of. They are stabilized and they are sent to higher centers. So this is the three-tier system. In all of these places, this trauma registry, an online portal, is being implemented, wherein the patient can be monitored from the time of the accident till the time of patient is being surgery is conducted, or whether the patient is transferred to the ward or the patient is discharged from the hospital. So now a new initiative of this government is the first time in whole of India, Tamil Nadu government has brought in this emergency medicine department, hitherto which was not available. Here in Tamil Nadu, nearly 25 medical colleges have got the emergency medicine department, which is a new department which caters to only emergency patients. Previously, all the other departments would pitch in and look after all these cases. Now, a separate department has been created, and we have created nearly 100 seats, emergency medicine postgraduate. So in future, probably in 5 or 6 years, Tamil Nadu will be the first state among other states in India to have a full-fledged emergency medicine department and emergency medicine PGs, professors, associate professors, etc. And the next one is the lifestyle diseases, non-communicable diseases, which is becoming the health department, the health functionaries, the policymakers are seized of this matter because these lifestyle diseases like hypertension, diabetes, cardiovascular disease like ischemic heart disease, CA like a stroke, and cancer is becoming a major menace to the society. So that the government is very worried about the mortality and morbidity of these diseases among the people. So a lot of effort, lot of policies, and a lot of proposals are being prepared and being implemented to control this NCD problem. As this cannot be done only by taking tablets or treatment. The major factor involved is here is to make a change in the people's attitude, people's habits to be followed. So one of the major initiatives of this government is creating a SBCC strategy. That is a strategy for social and behavioral change communication, wherein we would like to create a change among the people in their behavior so that their hypertension, diabetes, and lifestyle diseases are being prevented or controlled. That is a major. This strategy is being developed in coordination with John Hopkins University, and we have already developed the strategy. It is in the final process of going in for a government order, which will be implemented all over the state shortly. And one of the major flagship programs of this government is we have found out that even though these diseases are prevalent, you will be shocked to know that the prevalence of hypertension among the public is 25% and above. If we take this all, 1 in 4 among us would be hypertensive. And diabetes, which is an increasing burden in India, and 1 in 15 of us, 15% of the prevalence rate of diabetes, 1 in 7 of us will be having diabetes in this hall. So cancer is also becoming a major threat to the society. 1 in 10 is liable to get cancer, is what studies recently showing. And the government has come up with a flagship program of Makkale Thedi Maruthuvam, wherein we are giving services, NCD services in the form of screening for hypertension and diabetes, and a lot of dialysis cases are being taken now because of this diabetes, and we are giving peritoneal dialysis bags to all the people in the field free of cost, and also palliative care services to terminally ill cancer patients are being given in the field level. So that is a major impact of Makkale Thedi Maruthuvam scheme. The people are getting screening and treatment at their doorsteps, so that we have increased the surveillance and the treatment of cases of hypertension and diabetes, thereby reducing the burden and out-of-pocket expenses of the population in this regard. And one more major scheme which is being implemented by the Tamil Nadu government shortly is workplace intervention. During the Makkale Thedi Maruthuvam scheme, we came to know that we used to cover only the people who are at home. So when the health workers go to the home, they are not able to meet the people who are going for their work. So that we brought up a scheme where there is first to cover the organized workers, then the non-organized workers. So all the factories in Tamil Nadu which are having a workforce of more than 1,000 population will be covered under the scheme. So that health camps will be held in these factories or institutions, and the screening will be done for this lifestyle diseases. And health walk scheme is a scheme which has been announced in the budget, where a 8-kilometer walk is being implemented all over Tamil Nadu on a fixed day in a month, so that all involved can go for a walk for 8 kilometers in a specified route, followed by which a screening will take place. And we have identified some short-term, medium-term, and long-term strategies for this control of NCDs, which will be at individual level, community level, schools and colleges, and also in workplace. So this is a major initiative on NCD part. And as RCH part, reproductive and child health, we have two major digital platforms involved. One is the PICME platform and another is the MRMBS platform. The PICME platform, the pregnancy and infant cohort monitoring platform, which uh, collects all the data regarding the antenatal care and the delivery services given to the and post delivery services given to the pregnant mothers, which is being data is being collected and implemented on a digital platform. And also MRMES is a financial assistance given to the pregnant woman to upkeep their health and nutrition. That is also being monitored and data captured and throughout their pregnancy period through a digital platform. And operational research programs are also being taking place, and dissemination programs are also happening throughout the year to disseminate the findings of the operational research in all the activities I've told above to the concerned stakeholders. And one more initiative, which is a single platform for training, that is Tamil Nadu Quality Enhanced Structural Training Program, that is TANQuest. That is a new initiative wherein previously lots of people would have had training in lots of spheres, but it would not have been properly registered or properly documented. Now, all over Tamil Nadu, in all health institutions, these trainings are to be given, and a single platform, online platform, will be developed so that all the data regarding all the trainings which have been taken by the individual will be monitored and documented there. And one more important initiative which is being implemented in Tamil Nadu, a pioneering initiative, is the Population Health Registry, wherein previously the government had the health management information system where the hospital's data, all the hospital outpatient, inpatient, surgeries, postmortems, dog bites, snake bites, ischemic heart disease, all the data of the hospital, lab tests, and everything uh, everything would be done in a health management information system. But now we have developed this population health registry where individual patients' details also are being gathered and a unique ID will be given to the patient, and this will be monitored in an online platform. Lastly, I would like to come. I'll wind up with the health assembly system, wherein this health assembly is conducted in block levels, then it comes to the district level, and then it comes to the state level. Here, the top to bottom approach, where the policy decided by the top to bottom approach is avoided, and the bottom to top approach, where all the proposals come from the public regarding their health needs, is brought up to the top level, and the policy is being framed, and budget has been allocated, and implemented state over. So I thank you all for giving me an opportunity to highlight some of the activities which are being carried out by our department. Thank you all.
Thank you, Dr. Hirian Ravi Kumar. Very nicely presented session where you informed us about the digital app created and how effectively different databases are analyzed and the insights used very effectively. Before I call our next speaker, I will also like to mention Mr. Gagandeep Singh Bedi, as the Principal Secretary, Health and Family Welfare Department, Government of Tamil Nadu, was supposed to join us as a special guest, but at the last moment, due to the Assembly, Tamil Nadu Assembly session going on, he has got engaged there on some priority communication, and as a result, he was unable to make it here. So for our next session, we have a keynote session by Dr. G. Gerard Maria Selvam. He's the Additional Director of National Health Mission, Government of Tamil Nadu, and he has been specially recommended by even the Managing Director of the National Health Mission, Government of Tamil Nadu, to highlight the initiatives undertaken under the NHM in Tamil Nadu. So I'm sure he will provide us more useful insights and we would come to know about on the policy front what Tamil Nadu is doing on the healthcare. So I'd like to welcome Dr. Gerard Maria Selvam to please come over.
So, good morning, everybody. So, I'm really happy to be part of this event and to be able to meet everybody and share some of the perspectives from the government of Tamil Nadu side, how health and IT or the technology front have gone together. I have few slides to present, and maybe certain experiences we have gone through all along, which automatically brings certain insights and wisdom can be very well shared in this forum. And I also leave it to the audience to interact. So, with certain things which have been in the back of my mind, I've prepared few slides. And of course, any other further discussion, maybe which would be helpful. How to move it? Okay. This is the one. Huh? This is back. Right. So, enabling healthcare with technology. The first slide, I would like to talk about healthcare delivery and healthcare system is undergoing a significant transformation. And for a health system, for policymakers, for governments, for health systems across the world, we have to cope with this rapid transition. So, as as long as rapid technological advancements keep happening, the healthcare also is really competing with the other interest in the field of technology. So, where do we stand, all of us? Today, we stand at the intersection of the healthcare and innovation, which has got a lot of power to revolutionize how well the healthcare can be accessed and provided in a more and more better way than what it is now. So that is what makes the situation very demanding, because you can always improvise, you can always make improvements on your technology, and your healthcare will always be better. However, as we all set on this journey, it is very important and essential to recognize what are the different challenges that are strongly embedded in the current healthcare system. So, the challenges across the country, including Tamil Nadu, will always be to look into certain important aspects, which are your accessibility, cost factor, whether we make a change, even when we provide free services in the government, we should also look at the out-of-pocket expenditure. So it is very important in any form of expenditure which patients sometimes incur, the cost factor, the access issue, how the data is put in, how the data is generated, how the data is managed, and what do you mean by quality of care? What is the benchmark for the quality of care? What is that satisfaction level we often talk about? The agencies, organizations, different agencies work on the patient satisfaction. What does it really mean? For the purpose of innovation and technology, we need to always embrace new solutions and improve upon it in order to transform the healthcare. So, how do you enhance the accessibility? Technology is a very good tool which can bridge the geographical gaps, connecting patients with the providers even remotely. Telemedicine is a buzzword. Everyone talks about telemedicine these days. So, like when you talk about telemedicine, you can talk about the e-Sanjeevani teleconsultation services, which has been operationalized through the National Health Mission across the health and wellness centers in the sub-center level. So that is one innovation, a very simple innovation, which is reaching the benefit to the remote corners of the country, where patients within the area of the subcenter can have a consultation, and which prevents them from or avoids travel their part to the nearest PHC. So that is how the technology has to be looked into the context of people's situations. So in Indian context, which varies from state to state, we have to have a larger view of how we put this accessibility in the right perspective, reducing cost. So efficient gains through the technology. How the technology can also be cost effective? That is the question. So and remote monitoring can help contain cost and make healthcare more affordable. So when we talk about monitoring, we often think of a physical monitor. The monitoring context varies. In a clinical setting, patient is monitored, and the patient's general outcomes in chronic diseases like non-communicable diseases. In that context, unless and until acute emergency set in, normally patient can be very well monitored over a long period of time. Because when we talk about NCT, we talk about long-term care. So there, it doesn't mean a close critical monitoring. So all these things are the ones which we have to critically look at, which can reduce cost. Data management, electronic health record or electronic medical record, whatever we call about, is a very, very important tool. But how updated is the EHR, electronic health record? How well updated it is, and how it seamlessly takes in the continued clinical data of patients and patient movements. Patient moves from facility to facility. It could be from government to another government facility. It could be from government to private or private to government, because we don't have a control on people's movement. But the visits made by the patients can be of different types. Yet it is one and a single patient and one and a single data, one and a single body, one and a single health. So that is how policymakers, if the governments look at the person. That is the philosophy. That is the wisdom behind using a technology. So for a private driven provider, it will be more of within their margins, within their objectives, ambitions, they will look at the patient. But for a government system, it looks at a patient's movement as part of his health episodes, which probably starts from the time a child is conceived, a fetus is conceived, to the time we are declared dead in some place. Could be a hospital or a home. This is all life. It's all life about. So if this is all life about, the healthcare system also looks at the life about situation and tries to put the IT technology in the correct perspective. What do you mean by the quality of care? Now, a lot of things are coming. It is very attractive. If you go anywhere, people use the word artificial intelligence. Now, artificial intelligence is it's an evolving field. It's too early to jump on the board, but it is a welcome. It's a welcome. For example, Tamil Nadu government, we have introduced a robotic surgery, which happens in the Omadura Hospital here in Chennai. Now, this is one concrete example. But overall, there are a lot of implications behind artificial intelligence, data privacy, data management. A lot of issues are there. So even when it comes to handling the patient's data, there are uh, a lot of things which are accountable to the patient. So as a IT, when we are using the IT platform from the government side, we seriously take into consideration what we should do with the data, and we have to protect the data, and the data should be protected in terms of the security for the patient. So artificial intelligence I touched upon, and when it comes to surgical modality where you want to have the precise and personalized care, very precise technology where you involve cancer therapy, a lot of AI definitely comes into picture. Because in cancer therapy, you talk a lot about a very, very, very micro level, very specific level, very organ within the organ, a very specific site specific treatment. So when they focus on such things, definitely the AI technologies are bringing in values, which I don't deny, but at the same time, it's too early to be upbeat, to start with about the AI. Now, if you take about our National Health Mission, some of our initiatives like laboratory information management system, LIMS, and also the sample transportation system, because you don't have to make the patient move from one place to other. You can transport the samples, but it should be linked to the IT application. So all that is again cutting the cost. It makes it accessible. It improves the quality. So over and over, if you go through the same titles, you should connect them with the services provided and the technology provided. And you should question each aspect I've shown in this slide. So that is how I am looking at all this IT is all about. So going to the next slide. Healthcare delivery in Tamil Nadu, a lot is talked because Tamil Nadu has got a very robust healthcare system. So a lot is talked, well known across the country. So we have a very good network, a very well developed public healthcare system with your PHCs, primary health centers, hospitals, medical college hospitals, and it does provide. Undoubtedly, it does provide accessible and affordable healthcare for its people. And you have certain platform which we call the Health Management Information System, HMIS, and linking to the citizen, which is called the PHR, which my earlier speaker mentioned, sirs mentioned about it. So you have got your HMIS, your population health registry, which I've shown as a broad foundation in the there, and you have lot of applications which have to be ideally going into like a puzzle piece. It should go into the basic platform, which is your HMIS. So that is the vision, that is the wisdom of operationalizing your health activities with technology by government. So the next point is I would like to touch is always you have to prioritize preventive and primary care if you want to run any health system for that matter for any government. So the more investments made in this area is very important. Earlier speakers are also mentioned about the strategy for behavioral change. So those which they said that their project they're doing it with the John Hopkins, it's very important, but many times it can be kind of like not really looked into, because behavioral change is all amounting to changing your lifestyle and bringing additional benefits to your own health. Easily said than done. So the strategies are definitely needed to work on them more and more in the times to come. So this is just a kind of a slide to tell you. It's a long story from 2007 onwards. So it's such a long story, and somehow or the other, I've been witness to a lot of these developments. But in a presentation, we can't say everything. But in one or two slides, I would like to say HMIS as a history from 2007 onwards, when it started with the World Bank supported Tamil Nadu Health System project. Now it is called Tamil Nadu Health Systems Reforms Program, from where Sir and his team have come. At the beginning, we used to call it as TNHSP, which initiated the pilot on the HMIS. So that went on for about a long experience. And then up to 17, we had that. Then we had to go for the second version of the HMIS, which is in place now. We are also going for the next version, HMIS 3.0. So when I say all these versions and years, what is the carry-home message for all of us? HMIS for health is always dynamic, and it can never stop with one vendor. It can never stop with one application, and there is no a permanent solution or a version which is going to suit all times to come. So that is the experience of the states. That is the experience of countries, that they learn in a hard way the ifs and buts of the managing your HMIS. So it basically, what is the aim of your health management information system? It should capture the real-time data. So real-time data, a very strong and robust connectivity, a very good connectivity, and a very good, smooth and easy to use application is all matters. Make to call it in a true sense real time. That will be always a challenge even for developed countries. So we have this operationalized in DMS and DME institution. That means your GH and medical college hospital, because that is where the patient care in huge number happens. With the primary health centers, we use the basic modules because the number of patients catered to is less compared to your secondary care. And your Reporting system, which is the MIS part, is integral. University part is there because of the MGR Medical University and the college is affiliated, the college management system. So all these are put together in your HMIS. Now there are different modules. I will not bore you with the things, but it looks like from the point patient where you have the OP registration, and from there you have patients have different places where they can go. They can go. They can be an inpatient. They may go to laboratory, radiology. When they are admitted, they have a laundry need. The waste generated have to be also managed. That is a biomedical waste. The diet you provide to the patient, clinical care you provide, super specialty clinic you provide, you refer, and all these things tell you that how HMS, technology driven HMS, has to take the complete events which are connected to a patient, whether he or she is an OP patient or an IP patient. So in the MIS modules, you have this clinical information, ancillary support services, administrative information, and also the program. Because National Health Mission takes forward activities for betterment of health through its various national programs. So you name it, you will have the national program. It could be TB, NTEP, National TB Elimination Program. It could be a leprosy program. It could be non-communicable disease program. It could be vector-borne diseases program. It could be any other programs which you commonly hear about the national programs. So they are all, so in terms of health system strengthening, the National Health Mission and Tamil Nadu Health Systems Reform Program and the JICA supported projects, all this are like your blocks in the building blocks, like building blocks, they actually anchor and strengthen the health system. That is how it is perceived. So the routine departments are there, routine health system activities have to go, which you can never stop. But the building blocks which connect them and strengthen the health system happens through a lot through all these initiatives which I mentioned. So the college module, I already told you, like that was academic needs. So we are right now we have got about 67 medical college and connected hospitals, 297 GH, and all these things they come under the health management information system, LIMS lab information management system, which I told you. So the patient don't have to go to the other lab. You can collect the samples and you can generate the result from the another point, and you can take out the result in another place. So all these things are very important. And the PHCs basically give the MIS part. They report on their activities, which is called MIS, Management System. When it is real-time clinical oriented, then it becomes a patient-centric real-time data. This is another interesting picture you see here, the umbrella population health registry. What is it all about? Here we try to basically explain in a very simple way. For all the healthcare services, you need a common denominator. So what we do is you link a patient as a citizen and you allocate a number, which you call as the UHI, Unique Health Identification Number. So by doing that, what do you achieve? In the beginning of my presentation, I told that you have to look at a person's life as a life from the time conception to death. You go for various needs. First time the mother goes with a child inside a room. Then the mother goes after the child is born to the thing. Then the child grows into adolescent, adult, walks into life, goes through all the troubles of related to health. All these things, if you want to really see whether it happens in a private or a government, wherever, you need to connect to a number. That is your population health registry. So this needs a little mapping exercise down to the street level, so that this becomes this becomes an important tool for handling patients in the long. And this is one important application. And then the other one I would like to touch upon is your some of the important applications already sir has mentioned. So I will not go over it again. The PICMI, which we told about, which tracks the mother, pregnant mother, and also the child after it is born. Then the registration and also certain benefits we give to them. Everything is monitored through this technology called PIGMI technology. Makkale 3D Makkale is a flagship program of the Honorable Chief Minister of Tamil Nadu, which you have heard a lot, where we provide home-based services. One of the important aspects which I'll touch upon here is These home-based services where we provide drugs at home, we provide physiotherapy, we provide palliative, and also deliver the peritoneal dialysis bags. These are important services which are also again connected by way of technology to a portal which we call as MTM Likeness Portal. So we have this one of the robust and a very strong portal, I think one and only of its kind in the country right now, where all the live-listed NCD patients you can access through the portal and you can follow their progress, control rate, and referral. So RBSK is another important innovation. The state has gone ahead by coordinating with the education department so that the teachers in the school education department can put in their own application, TN school education department application, the children who need attention, and that is in collaboration with our RBSK, school health program doctors. They are able to capture that information because there is an interfacing between the two applications. There's a sharing of this important things between the two applications. That is an innovation on the part of government of Tamil Nadu, which enables early interventions for the school children. So this is what I was talking about, the EMIs, Education MIS, Tamil Nadu EMIs portal integration with your RBSK. So in conclusion, this is my last slide. I'm going to wind up now. So we need data. We don't need data in pieces. We need to have a comprehensive health data management. And you should be able to also look at the surveillance point also. You should be able to have an early identification of the health events in the community, not only the individuals, also the health, the profile of health events in the community. What are the important interventions we have to act, we have to do, we have to act upon, the targeted intervention, that, data-driven decisions, that is important. What is the health outcomes of what we're doing? Yeah, we have to look at our own performance. What is the health outcome I'm achieving? And monitoring and evaluation. Health technology as a monitoring and evaluation tool, and data-driven decision making for policymakers and for the implementers equally important. It is not only for the government and the policymakers to look at it, but the implementing bodies in the field. They themselves have to use their own data to tell them where they stand, where they do not stand. So with these few words, I finished my presentation. I just said, as I said earlier, from what was in the back of my mind, I tried to convey certain things in the angle of health and technology. Hope it was useful for everybody. Thank you.
Thank you, sir. And very conclusively, 3 points which spoken in terms of the data-driven insights, and then monitoring and evaluation it on a regular basis, and finally the outcome, outcome based. These are the three important points. So before we conclude our inaugural session, I would request Sangamitra Mohanty, co-founder and director of APAC News Network, to hand over a small token of appreciation to our speakers. Thank you, sir. With that, we conclude the inaugural session, and it was a pleasure being with both of you. So now we come to the panel discussion. Basically, the topic of the panel discussion is about digital hospitals that are emerging in the future, and how these digital hospitals are leveraging technology, which transforming the fundamental paradigm of the care delivery, patient experience, as well as the staff management and operations management in hospitals. How increasingly technology adoption and digitization is taking effect in these hospitals. So for this panel discussion, we have an esoteric set of panelists, and it's my pleasure to welcome on stage P. Bharti Reddy, CEO and Managing Trustee, Vijaya Group of Hospitals. Dr. Kishore CM, Vice President, Healthcare Services, Be Well Hospitals. Dr. Natesh B, Chief Operating Officer, Lifeline Multispecialty Hospital. Welcome. Dr. M. Dinesh, Medical Superintendent, Madras Medical Mission. Welcome, sir. Mr. Saundar, CIO, NGM Healthcare. Shweta Sharma, Segment Head Building, Schneider Electric India. So, lady first. So I'll start with you, ma'am. My first question, not just getting into deeply into the technology innovation. Very broadly, I would like to ask fundamental questions. When we are talking about the operations management issues like staff management, the hospital ecosystem will have different stakeholders there. Patients, obviously, the caregivers, the doctors, then the administrators, then the other constituents. So this overall operations management and staff management, what role increasing technology is playing here to sort of facilitate the overall process and smoothing the process, improving the outcome of patient care. So, what are the role you see there? Take mic.
Am I audible?
Yeah.
Yeah. So I come from a 52-year-old institution, which is we just completed 52 years, and we have been into patient care right from day one. And we have staff who have been with us for more than 30 years. So changing their mentality and getting into digital platform was a big challenge for all of us. Yes, so we went into this HMS system in 2007, no, 11, and it was so difficult to make our staff understand why we were doing it. So basically they thought they were going to be displaced from their jobs, and that's the mentality which most of these the staff had, and of course we had to interact with them and discuss with them and say this will be the best thing because it will make integration better where patient care is there and communication better. So this is how we started it off, and just to say that today we have started a new software just last night, and that was also another big challenge because we knew we had to advance in our technology. We were still behind. So to get to look at the DHR and EMRs and interoperability plus connecting departments and making our consultants who have been with us for 30 years, get into this digital system has not been an easy task at all. So that is how we have started, and definitely, we have interacted. We have our IT system department, which has been interacted from day one, about how to go about it, taking their feedback, telling them that, you can ask me questions and we will be answering you. So make changes according to them. That's how we brought it in, and I've just got a report that it's running kind of smoothly, but it's still not there. So yeah, so this is what digitization is going to do to us, definitely, and we definitely are looking to patient care and bringing the real time data. That's what we are looking
So
at. Yeah.
you have hit upon a very pertinent point. So we talk about the technology, the software deployment, and the things, but the cultural changes that are required.
Absolutely. Yeah.
That's perhaps even more crucial. Without that, whatever software or technology you deploy
Absolutely. And
might never work.
us being a trust hospital, we also had to look at the budgeting part of it, which is not easy. So we had to on a phased manner. So we had 1, 2, 3 phases we have, which we chalked out. So that's how it's going to happen, because then,
Okay.
we have to make people understand that the long-term savings on the ROI. That's what's very important, I think. So
Perfect.
yeah, thank you.
Thanks.
Thank you.
Thank you. Next panel is Dr. Kishore. Um, I'll come to you the question when we're talking about the digital hospital. From a Be Well perspective, as well as from your personal perspective, what do you understand by a digital hospital? And very briefly, ma'am also touched upon two of the challenges there, budgeting and the cultural issue. Beyond that, any one key challenge you would like to highlight in such a digital hospital?
Thank you for asking the right question, because right now, one of the main challenges that we're facing is in training of the various stakeholders of who are going to ultimately utilize the technologies that we are putting forward. And oftentimes, attrition is another challenge. In today's hospital scenario, what we are noticing is a very high rate of attrition. So once we train our stakeholders, it's not always that we are able to retain them.
Okay.
So then again, a new individual comes into place, and then we have to retrain that person. And oftentimes, this is one of the major challenges that we face whenever we try to implement a new technology or a new system in place. This
And
is
anything about briefly would like to mention about digital hospital?
in terms of setting up a digital hospital in India. I think we are very, very far away from actually what is done in the advanced countries. For one main reason, in India, still manpower is reasonably well accessed and cost effective. In fact, post pandemic, I think in Germany, there's a shortage of 250,000 nurses that they require. The only way they're going to circumvent this problem is with technology, by using more and more technology to circumvent this. But in India, I think we're a little far away from that point.
True. Thank you. Dr. Natesh, I'll put the same question to you. Your perspective, especially from a lifeline,
From a digital
also on a digital hospital, how it would look like, and how would you go about those kind of deployments? Maybe infrastructure-wise, if you can highlight it.
First of all, let me thank APAC News as well as Schneider Electric. I think to spread digitalization of the hospital, we need more forums, because especially among the medical community, I find that the concept of technology itself is a little bit, I don't know, they're very apprehensive, very resistant. Sad to say, even doctors are resistant. But we are very good at Facebook, Insta, and all that. But when it comes to technology in the hospital setting, we are very, very resistant. But let me talk about a few challenges I've seen, because apart from being the chief operating officer of Lifeline, I'm also the CEO of a company called Helia Digital, which is based in the US, a sister company. We're doing a lot of cutting edge work in digital medicine, and that is very relevant because that's the future. And before I start off by talking what we are doing, I would like to make a request to Schneider Electric. I heard Nikhil speaking, and he was talking about a lot of IOM devices, very impressive, Nikhil. But if you want to really push this across hospitals, we need to get it to even the small hospitals. Big hospitals can definitely afford all this. It's just like India, digital payments. We're the highest country, the highest number of digital payments is done in India. It'll be so surprising. We'll be thinking US is the highest, but no, it's India. Why? Because you go to a village, when guy is selling tender coconuts, has got a QR code there. So it is only if you reach small hospitals, if villages can get healthcare. That's when real digitalization of hospitals will happen. And that's when you can really call it a digital hospital. Because today, now I'll talk about the product we have done. 2 months ago, we released an app called the Truster app. We hold world record now, a Guinness Book of World Records for doing a health checkup for 11,800 people in 3 hours. How did we do that? The app, you just have to look into the app and it reads out your parameters. It reads out your parameters like it gives you a BP, your pulse rate, your oxygen saturation. And this actually another few apps can do, but we are the only ones in the world to show. It shows you your HbA1, it shows you your blood cholesterol, and it shows something called your stress level, which is still under thing. Now you can ask me, how do you know these are true? This is now FDA certified, right? And that's done by a lot of studies. And what's in the works is we are also doing uric acid, urea, creatinine, all these are coming. It will come another 1 year, all parameters, completely non-invasive. You just need to look at it for 1 minute. And medical grade. You're not talking about, of course, right now it's just at the screening level, but even at the screening level, when you imagine a country like India, we did 12,000 people in a village called Podutturpete. 12,000 people. Kishore is very close to us as Lifeline, as is his father. So he knows the program. It was inaugurated by 3 union ministers, and we now hold the world record. So what I'm really trying to say is this is the future of medicine. And digital, I would like to differ with my very good friend Kishore. Digital hospital is going to be the future, and India is going to lead the way. I'm very, very sure of it. India will lead the way, not the other way around. We're already far ahead of the West in many, many things in AI.
Got the point.
Yeah.
Thanks. The example, what you have shared, it's excellent, though, in terms of considering the connectivity quality across the country, uniform standard, maybe the practical mass scale implementation is a little bit far off still on that. I'll next come to Dr. Dinesh. And I'd like to talk more on the infrastructure perspective. From a hospital perspective, when we are talking about increasing digitization, see, things like sustainability and resilience are also very critical. So from a hospital operation perspective, when increasing digitization is happening, how are you looking into those? So I was saying, making the hospital more sustainable and resilient.
Yep. Good morning, one and all here. What thank AP and fellow panelists. Digitalization of hospital is, I think, we are at the starting or the stepping the first stage into it. And to sustain into the digitalization is like, I would say, I maybe, I don't know whether this forum is right to tell that. The other panelist, ma'am, said that the cultural thing, the people to get into the digital thing, they are not ready to get into it. But one thing, what I am seeing in the field is the youngsters are very much into the digitalization. So the upcoming youngsters, when they get into the digitalization, I think this will be a flourishing state of digitalization and almost the future of Indian medicine, especially in Tamil Nadu. The digitalization will go in a very high standards. Because there are a lot of fields of, sir said that with the app we can get a lot of information of the patient who can, it is easy to treat those patients and all those things. So that will be the future of the
Okay.
hospital.
Okay. So you're talking more on that perspective of the cultural changes, but I would like to maybe for digitalization to spread across culture. Very naturally, you would think the population that would come more into hospitals will be the higher age groups and the young generation. So some sort of inculcation into digitization perhaps needs to be done there. Okay, our next speaker is Mr. Saundar. As a CIO of NGN Healthcare, I would like to understand what sort of one or two key digital initiatives, technology initiatives that have been undertaken in NGN.
Good afternoon. Thank you very much. And thank you to proud to say that hospital is a paperless. We are into more digitization of wherever you go from registration to patients, pharmacy, all this QR code we are using it. I added 2, 3 points over here. Patients can scan the QR code and they can order the food and they can register the complaint online. They don't want to depend on anybody. Like patients complained as well as executive operations, they go for the rounds. They can just QR code, they scan, they get all the patient data, they can complain on it. As well as we have a patient portal that is a portal on our website. The patients can download the bills and the lab reports, all the things. They don't want wait. Once the patient's report is ready, that will automatically trigger to the WhatsApp to the registered mobile number, as well as they can download in that valid period. Then we have launched recently mobile apps for the patient. The same thing they can do it, appointments and patients can talk to the doctor 24/7. It will be soon launched in the public. Still is in the pipeline that we are doing it. Then we can say about EMR, about 80% compliance is there already. IP we are going to start. OP is completed. IP soon we are going for the EMR. Then one more thing like visitor management, we're using a QR code. Right? Earlier they're using all manuals. We are hosted on our website as well as in our security office that medical rep and general visitors they can take an appointment through QR code and they come and visit our hospital. So they don't want to have any manual work over there. Just go to the QR code. They have enter that mobile number and Aadhaar card or whatever visitor card. That will replicate in the security office just while they come. They can take their tag and come it off. Then same thing, we have an online feedback also is all it's an online. So we don't earlier the whole hospital use feedbacks manual. We're not using all the things. A lot of things in the pipeline. I would say thanks to management, whatever they say, decision, but management is accepting and we are going forward. Thank you.
Okay, even that is typical uh, to get the management buy-in in time. Shweta, I'll come to you next. We know Schneider is an infrastructure solution provider, and many of the hospitals represented on the stage as well as in the hall, they will have a huge infrastructure in terms of maybe even multiple hospitals across geographies. From having a resilient and hospital which is sustainable in the long run, how, as a solution provider, Schneider can help some of these healthcare?
Sure. So, thank you for the question, and very good morning to the audience and to my co-panelists. I heard my co-panelists talking about digitalization and listening to the especially, some stories who says we are like at a nascent stage of digitization. We have already initiated a good bit of digitization in the sector. Now, what I notice here is, we talk about different systems and subsystems in a healthcare facility. Like we heard ma'am talking about how people are like little still they are like that culture shift needs to come among the people, and then there are like QR code given and completely going paperless. So these are different subsystems in the hospital which we are addressing for digitization bit by bit. But what could be the next level? And that's where the technology providers like Schneider can come into the picture, is integration of these systems and subsystems. So today we have, first of all, healthcare is a very, very critical facility. And if we see among the building infrastructure, we consider healthcare as number one, like probably data center and healthcare come at par, where we have lots of stake of human as well as data being residing in these buildings. So considering the criticality of healthcare facility, I think we need to talk about a system which brings the proper management of the complete system, and that happens only when we monitor it. So we cannot manage something which we don't monitor, right? So we need to monitor first, understand, and then manage it. And monitoring is something where we need more and more digitizations. We talk about IoT products, we talk about data coming in from our different IoT enabled assets or equipments in the healthcare facilities, even in the critical rooms like operation theater. What do we do with these data? So we need a platform where we can integrate these data and utilize to manage the facility better and better. Now, this is one level of digitization, I would say. Now, if we talk about efficiency, now one of the output of digitization is certainly the efficiency. I mean, I'm sure all of us agree to it because we are managing it better. Now, as we move up the digitization cycle, we talk about like completely visible systems and subsystems inside a facility. Now, the next level could be where we are talking at the enterprise level. I think most of us sitting over here, we have multiple hospitals at multiple locations. And how do you benchmark these hospitals in terms of operational efficiency? If not in terms of the patient, being treated there, but at least in terms of efficiency of the operations. So that's where again technology can bring up the digitization scale, where we are talking about enterprise layer tools, software, services, where you have the visibility of not only the energy consumption, we are also talking about probably nurse calling system or hospital management system, building solutions, fire alarm system, all these critical facilities integrated at one place, giving you the transparent view of the performance of each and every infrastructure in your group. So that is another level. Now, beyond this, also, I think that's another, level of digitization, which I'm sure eventually we will land there, where we are talking about AI-based technologies, where we get the actionable insights coming from the data, what we are giving to the platforms. So that would be something which is like ultimate level of efficiency, resiliency, and that's the future, I would say. So in Schneider, we have open platform. I would say open in the sense like it can talk to any of the subsystems of the hospital, and we call it ecostructure. My colleague Nikhil had spoken about it. There are lots of data available or information available about ecostructure on our website. So ecostructure is one of those platforms which talks about integration of multiple platforms, multiple systems, subsystems in the hospital, create a seamless view, interoperable and completely transparent to the management. So that's something I wanted to highlight on digitization, how technology provider like Schneider Electric can help.
Okay, thank you. So excellent way you talked about the integration of the different critical systems as one of the pillars of that digitization approach, but perhaps that would be the next step of where many of the hospitals are today currently. I'd again come back to you, ma'am. From the first point that you mentioned, you talked about that cultural change within the hospital workforce. My question is, now there are different sort of again the stakeholders in that overall ecosystem. So how did you ensure that sort of all of them are gradually, and which you have said now, as last night, you had that second phase of software implementation also. What sort of training or uh, program regime you have to undertake to sort of bring them at par, not just making them culturally aware, but make them understand the benefits. So what sort of exercise you had undertaken?
Hello. Yeah, as I mentioned, we had to go into a lot of training and retraining. Without that, nothing happens. And we had a group of IT specialists, and we had our own doctors. One of them is sitting over here. They also got involved in it. See, when it comes to that professional level, the medical level, they have much more perspectives of what they would require and what we would require as a management. So when these people got together, then I think that's where I think it made a big difference. So then, as I said, we had to go to each HODs of each department and also the lower rung of people, because the second, like somebody said, the younger generations are smarter. So they were also, included in this thing. Yes, we can do that. Why can't we do that? Those kind of, they're throwing questions at one another. And finally, we brought them all into one room. I think it was the last stage where we had about 10 or 15 desktops where everybody was working on it, and all their doubts and everything was slashed, especially with the lab and the pharmacy and things like that. And yes, today we are touchwood. I think we're going on. I think it's happening. And as somebody was mentioning, what is digitization? It is basically what we want is patient-centric care. It is coming down, I think everything boils down to the patient.
Obviously.
Yes. So if we can provide seamless integration and, appointment systems and, availability of medical records, and later on, maybe like, we are the government of India is developing this, the Ayushman Bharat and the ABA, which has now come in again. So we will all be integrated, but then we all have to talk the same language. That's the problem here. So it has to be standardized throughout the country. If I have to go to some other hospital and I carry my personal records, it should be the same language has to be spoken, I think. So that's it.
Got it.
Yeah.
Thanks. Dr. Kishore, on these point of standardization, I'd touch upon an important point was the telemedicine and teleconsultation. And during the COVID pandemic, out of necessity, we saw a spurt in teleconsultation and those things happening, which after normalization has, I would say, not to that extent, but I don't think it has come down. So now there are a lot of legal guidelines to teleconsultation, also those things. So how do you see the more mainstream adoption of teleconsultation, and overall, as ma'am rightly pointed out, will it be improve the outcome in terms of patient care? So what do you expect there?
Teleconsultation, actually, glad you brought up the topic. In fact, I was instrumental in setting up Chennai COVID Warriors, where we did more than 75,000 teleconsultations during COVID. And this was very instrumental in bringing down the chaos and panic in the people.
True.
Not so much in the treatment part, but at least to keep them alleviated of the fear. As you rightly said, post-pandemic, I don't think we have seen that much traction in the teleconsultation area, but certain hospitals are doing well. For example, Apollo Hospital has one of the most leading teleconsultation setup across their 76 hospitals, wherein a patient can check in and get a consultation from any of the hospitals in their system, which means now individuals have access to specialists who were previously not available in their region or locality. Now you can have access across the globe. So definitely teleconsultation is far superior and far one of the most highly utilized tools in the digital equation in Indian hospitals setup. But yeah, it's definitely here to stay, no doubt about that.
Okay, thank you. Dr. Natesh, we earlier touched upon the sort of, if I may say, democratization of digitization in hospitals should not be only restricted to the big or the super specialty hospitals, but even the smaller hospitals who perhaps cater to the mass population. Uh, so, delving a little more in depth into this, when we are talking about democratizing it among the smaller hospitals, what are the barriers? We heard about that cultural thing. Okay, that can be accepted. But beyond that, technology-wise, what do you think are the barriers?
See, in a country like India, where insurance penetration is very little, right? So, and most of the people, I think the mass of the people go to neighborhood doctors and clinics. So I think that is where we need to reach. And one of the main reasons why I think they're going to find it very hard to digitalize is the cost. Obviously, Schneider Electric has a lot of things. So one request I would make to companies like Schneider is to see how you can offer it like a SaaS model, right? These small hospitals cannot afford to pay an upfront fee of so much and then wait for recovery. Maybe if they can pay monthly, right? If they can pay like a service fee and amortize over a period of time, I'm sure that will help penetrate digitization much more. Second thing, like Madam touched on, is training. It's not enough if Schneider just installs the equipment, trains somebody, and then leaves the scene. We need the hospital people, especially technical folks in the hospital, are very few. CIO of MGM is here. I mean, I'm sure he has a tough time educating doctors because they're always interested more in patients and all that. But this is to help them deliver care better to patients. I think if you can have continuous training, once in 3 months maybe, or even once in 6 months, that will help the entire hospital ecosystem to
Exactly.
actually get better into the game. And it'll, for companies like Schneider, it'll become more of a pull game rather than push, right? If it's easier, if it's accessible, and maybe if you have one person from your team there in the hospital or in the region, I'm sure adoption will become much easier.
Okay. Dr. Dinesh, another basic fundamental thing I'd like to, we heard about the budgeting issue twice. My question is, all technology deployment is fine, but we can think of innovative models like SaaS model he mentioned, but otherwise, whatever technology will come at a cost, operational cost, and for a hospital, some of that cost have to be passed on to the patients themselves, which increases the overall expenses, patient expense. What is the solution?
Actually, good question. So I think whenever we say technology and digitalization, we say it is costly, but I defend that point. Because, see, we just look at the price. For example, if you are going to get a software, you just look at the price, what they are going to, like, for to say this is the money. See, initially, there will be a little bit of investment. So just for example, the EMR or the electrical medical record or health record. See, I'll take MGM, they are paperless. In our hospital, we just did a cost effective, we did what will be the thing which will make the cost higher. The papers what we use and the paper what we make and what we buy and write, if you calculate the amount of money spent on that, easily you can get into the software and it will be much, much cheaper, because we always think in one way that its technology is at the cost. I don't think so, because the people mindset have to change, because sir said about this, the UPI online payments and all those things. He said US is not the country which has highest digital money. India is doing it. 75% of the thing is done under the thing. So it is only when the thing came in, there was a lot of things. They said no, yes, so much of things. See, even the digitalization also has the same point. When you understand, it becomes easier. It becomes much, much easier. So, and it is cost effective. If you ask me, I'll say it is cost effective. When you compare as a whole, what you spend for other things, when you are going to cut down those expenditure, you are going to get a good outcome, which is going to give a very good quality to the patient.
Okay. Excellent answer. Thanks. Sundar, what I would like to know is from an MGM perspective, next 12 to 18 months, the key technology projects or implementation which are on the anvil, if you can highlight that.
Yeah, of course. We are planning to remove all edges, all manual edges. That is our key. Like for example, appointments, a lot of registration count somewhere, labs, all things. There is no ledges will be in the labs area. Everything will be in system. That is our pipeline. Secondly, what I mentioned, I forgot to say some more IoT also we are already enabled. We are working for more than 4 years, like AC, temperature and water, all the things, all the things automated. So we don't want, we have a full building material, BMS system we have. So fully, we can see, come and see that MGM Healthcare or hospital is fully computerized and we don't have, most of the time we're not using any papers, all digitalization and mobile apps and QR codes that way. I can say that we have one more hospital in the MGM Cancer Institute. There also we have the oncology unit there. We are working with our software vendor to make more customization of oncology unit. That's in our pipeline. Thank you.
Okay, thank you. Shweta, you will have the last word here. Two things. You heard all the panelists, and earlier you talked about the integration part of the overall thing in the roadmap. Now, two very fundamental points. One, the budgetary cost, which is so as a solution provider, it's I can understand it's not just simple. I'll reduce the cost. There are a lot of dynamics involved. So, in an innovative model, one that budgetary challenge, and the other challenge is again it's not uniform across. But you have to maintain certain uniformity or standardization to do this implementation. So these two challenges from a solution provider perspective, how do you look at overcoming?
Okay, so before I get into your question, I acknowledge you, sir, for your point and the urge which you have made to the technology providers of the company, of the country, to take forward and address the basic root-based problem. So I take it forward with my management and we will certainly action on it. Okay, now coming back to the question. So yes, there are challenges whenever there is a change coming in or any kind of transformation coming in, there will be challenges and we all acknowledged it, right? So ROI is one way of looking at it. We spoke about, buying a software, implementing it, and then the return out of that software could actually be, more than how much we are spending in the conventional way of working or operating. Now, what technology can do over here is, like I spoke about, integration. Integration plays a very, very big role. And integration, I'm just, highlighting the points which I spoke. So integration is one of the things which has the power of giving more and more visibility of things what can go wrong in future also. So being predictive, and more importantly, being proactive in your approach. Now, healthcare being a critical facility, we need to be proactive. Everything is so focused on patient. So the technology, as a technology provider, even at Schneider, I mean, there are many organizations like Schneider and technology provider like Schneider. When we talk about technology in healthcare, the focus or the end goal is patient journey, giving a good experience to the patient and also patient safety, which I think is extremely important. Throughout the patient journey, patient might be put on unseen risk, which needs to be eliminated. Now, the technologies, again, which integrates the systems and subsystems, has the capability of going to the next level where I mentioned we will be able, through the logics and through the artificial intelligence, we can program the software, we can program the tools and the dashboards to throw the outputs to you well in advance before the incidents actually happens. So that is the kind of, that is the level of level of integration and level of digitization which comes into the picture. And we all know if the accident happens or any kind of, say, power outage happens, what is the risk? What is the business risk? Not only, of course, there is a discomfort to the patient and to the staff, but then what is the business risk we are carrying? So all those things are never calculated when we talk about ROI, but these are something which is certainly to be considered. Another very important point I would like to highlight here, since we are in Chennai, Chennai could be Chennai, or for that matter, Tamil Nadu could be one of the best states we can have when we talk about digitization. I was just going through an article last evening while preparing for this forum that 45% of the medical tourism coming to this country comes to Chennai alone. That's a big thing. And 35 to 40% of the medical tourism domestically come to Chennai, one single city. So the kind of infrastructure, medical infrastructure, healthcare infrastructure we have in Chennai, or for that matter in whole of Tamil Nadu, is extremely appreciated in different forums. So why not take forward that next step and create an example further? So that's
Chennai
my
and
message.
Vellore together will contribute, I think, maximum of that 45% of the national
Sure.
and even international medical tourism. The South Asian countries, so many people come here, and it can breed. It's already breeding even accessory areas around it. I'm sure across those Apollo and next to all these houses, guest houses and everything, those businesses are flourishing. Okay, great. Thanks to all the panelists. Yes, sir. Can we have the mic?
My voice is quite loud. I want to congratulate all the panelists. They have highlighted a series of challenges. I come from a background of technology entrepreneur. I was involved in transforming the entire healthcare in US from 2009 onwards. So we heard Sweta talking about digitization, digitalization. I didn't hear digital transformation, right? So these are the three phases of transformation which one would like. I'm right now a researcher. I came back from US and now I research on how digital transformation is happening in healthcare. So as Sweta said, digitization is transforming the analog to digital form. So my concern with all the healthcare administrators would be, what are we doing in terms of moving away from prescribing everything on the paper, which doctors told that on long term it would be much more effective, right? So that's something which we need to still work around. I go to many hospitals and I still find there is a resistance in terms of prescribing everything in a digital form.
Okay, sir, I think
By my question, I wanted to be very quick and crisp, is how do we help the entire healthcare? Healthcare in Chennai is pretty good, as you were saying, Sweta, but the next challenge is digital transformation. So my question to all the panelists is, how do we visualize the future smart hospitals in Chennai? Thank you.
Anyone would like to, or we have the next topic, next panel also on the same topic, and maybe after the discussion with all the stakeholders, we would like to take this up more generically on this platform, because we are running quite behind schedule already. So I would like to thank all the panelists again. Can we have a group photo, and after that I would have the second panel. We now come to the second panel of the day, and this is also on digital hospitals of the future. And I didn't get your name, sir. The gentleman in the audience talked about how digital transformation of hospitals. So maybe we can take this up on the second panel. So for the second panel, I would like to call on stage Dr. A. Subair Khan, Managing Director of Orthomed Multispeciality Hospital; Venkat Panidhar, Group CEO of Medway Hospitals; Dr. N. Kannan, Group Medical Director, Dr. Mehta's Multispeciality Hospital; I think we will need more chairs also. We'll need more chairs also. Dr. Stephen Matthew, CEO, St. Isabel's Hospital; Dr. Surendran P., Medical Superintendent, Sri Ramachandra Medical College and Hospital; Dr. C. Emmanuel, Director, Academics and Research, Gleneagles Global Health City; Dr. C. Rajesh Kumar, CEO of Venkateshwara Hospitals; Mr. Rahul Talwar, Global Segment Leader, Healthcare, Schneider Electric; So let's, since the topic is the same as the previous panel, and we heard all the, so let's have it in one way. First, I'll come to each panelist, and very briefly, 1 minute in each of you. Very briefly, when we're talking about a digital hospital, your vision of the digital hospital, what does it entail? Very briefly, in 1 minute, if each of you can mention just the vision. We'll talk about the challenges and everything subsequently. But first, what exactly, because the thing is, we touched upon this lack of uniformity or standardization, because maybe the definition of digital, and the gentleman from the audience also mentioned very importantly digitization, digitalization, and digital transformation. So this digital hospital, the vision itself can be different. So starting with you, Dr. Khan.
Good morning, all, and thank you very much for the APAC for inviting me for this wonderful forum. And I think this is my second time to such a forum I've been attending. I come from a very small setup, not a big corporate hospital, and everybody was discussing about it should start from the small setup also. I should just brief about our hospital. We started with 15-bedded hospital 10 years before. In fact, from day one, we have made our center digitalized as to some extent, but now we have completely paperless with 100 beds now. To my knowledge, the word digital hospital means first thing is paperless. Second thing, all medical records should be electronized, or as sir was mentioning, it should be digitally transformed from prescription to the X-ray to the laboratory investigation. Everything should be digitally transformed. It was a simple solution which the resistance most of the time happening with our medical professional getting into it to make it as more convenient. We have found a solution for it. That is the templates. See, medical records can be made easily documentable by making it as templates rather than writing notes. So that is what we have come up with a solution, and it's working well with our
Okay.
center.
So primarily paperless and the medical records documentable digitally. Perfect. Venkat Panidhar, the same question in terms of your concept of a digital hospital. What does it entail?
So thank you so much, and thanks to the organizers for giving me this opportunity. Technology should not limit our timing. Okay, 1 minute is quite a small time for us to, actually express ourselves with such a loud and sound question from one of the gentlemen from the audience. Give me 2-3 minutes, but I will make it sure that they're all entertained. I had my own inhibition when I said that I'm very cultural in my attire. Okay, well, I will fit into, giving a lecture on technology. I'm so glad that you people gave me the opportunity. That's a good example that technology can fit in anywhere and everywhere.
Exactly.
So coming to what actually transformation to me is breaking the barriers of how we accept technology in our organizations. As a CEO and the P&L head for an organization, I look at three important, there's many, but then three primary things which can transform every stakeholder of a healthcare system. One is the clinical governance. You can address with digital transformation. Number two is patient experience, which again is going to affect on your P&L and your brand equity. Number three is your infrastructure and asset management, which is again very important. Unfortunately, we still talk only about HMIS and EMRs. We are not going forward more than that. So paperless doesn't mean that it is going to transform. It is actually digitalization. It is not digital transformation. I'll give you small examples. Okay, when we talk about, most of you are from hospital backgrounds. You are all from hospitals in administration and operations. Tell me how many of you know what is our readmission levels in the hospitals? I'll tell you. Okay, it is approximately around 10%, of which only 6% come back to your hospital. Where are these 4% going? To us, most of us, okay, an episode of inpatient going out after a medical or a surgical treatment, your end of service or end of treatment is the day he leaves the hospital, discharged from the hospitals. That's not the right thing. The recuperating period is also supposed to be considered as your actual discharge, what you call actual end of service. There's a huge gap between the day of discharge and the actual recuperating period. And we have certain standardized, applications, which general questions will be, put to these patients, and it is not customized to specific to the patient. Okay, so but we have applications. We have AI and algorithm-based applications which can be customized to the patient requirements, and we can be still connected, and we can, take care of the patient's health after discharge till the recuperating period is over. Number one. Number two, patient experience. What is the ratio between your unique patients to your consultation numbers in a hospital? Do anybody has a clue about that? It should be ideally 3.5 times. That is, if you have unique patients of around, say for example, 40,000 in a year, it should translate to 1.4 lakhs of your OPD consultations. But in average, we will have only 2.5. That is only a lakh of it. So you are losing on 40,000 OPD consultations. Your retention of customers is down by 1%. 40,000 consultations, if you lose, even if you take a minimal of 2.5% conversion of IP, it is 1,000 admissions per year. With a 30 to 35,000 rupees of RBOP, you are losing around 100 million rupees, 100 million rupees. I mean to say 10 crores of revenue, which translates to at 20% EBITDA, it's around 2 crores.
Okay,
Okay,
sir.
that's no, I'm coming there. Okay, the third one is about the asset management. Most of us, we know, we run on very asset light model. Okay, our monitors, simple thing is monitor. Okay, you send the monitor from ICU to casualty because there is an additional patient, and when it comes back, okay, you don't have a clue where the monitor's probe is there and where the battery is there. We have excellent AI and algorithm based asset management softwares. We don't adopt.
Okay, sir.
Okay, thank you.
I got the point. So you're talking about the applications, and basically what you are highlighting, we might be ignoring the way the monetization can be done. Even within the assets management was one part you mentioned. The patient management is also another part, and what we are losing and more optimally monetizing perhaps would be possible if we leverage those applications and those technology better. Dr. Kannan, your concept of a digital hospital.
My concept is very simple. What does digital hospital mean? It's a seamless patient experience. From wearable devices to telemedicine to electronic health records or patient apps, everything should be geared towards patient comfort, patient education, patient knowledge, and patient welfare. That should be patient centric. Second, as all of you know, biological sciences are not mathematical sciences. In mathematical sciences, 2 plus 2 is only 4, but biological sciences, 2 plus 2 can be 5 or 3. What I mean to say is, the respected doctors from government sector talked about lifestyle diseases. If you take the lifestyle diseases, for example, every patient reacts to a particular metabolic disease in a different way. This I am speaking as a clinician. Take, for example, diabetes. A may not react to the disease in a particular way, in a different from B. So what you require is trend line of diseases, how the metabolism differs from minute to minute by hour and hour. And this is possible only by digitalization, where you can do trend analysis of the patient as electronic record by which we can derive valuable clinical information, which will decide our management protocols. So digitalization basically means patient-centric. Doctor is only secondary to the patient. That is my idea of digitalization.
Okay, thank you. Dr. Stephen, from the Isabel's hospital perspective, how do you look at a digital hospital?
When we look at what is there in our vision, it's honestly quite different from what it actually is, because to a large extent, when you look at how hospitals are moving towards digitization or digitalization, we tell everyone whatever you were writing till yesterday on your registers, from tomorrow you enter into computers. So does that really solve the problem? Because the amount of time which is spent on data entry, whether it is in a register or in a computer, is the same, or maybe even more when they switch to a computer. So as Sir said, I echo that there should be variables, there should be an effort to reduce the amount of data entry time for every employee group, not just doctors, definitely, especially nurses. If you talk to most clinicians and even patient attendants, the most frequent complaint is when we look at the nurses, they're always writing. And we are the ones who are telling them that they have to write. So every area should have the data that they need on a day-to-day basis, which is automatically captured by a system. And each department should also get the insights they need to make their work more effective. Till we reach that, I think we are quite away from our goal.
Okay, Dr. Emmanuel or Dr. Surendran,
Good afternoon, everyone. I come from a teaching hospital where we have almost currently 2,000 patients inside. Now, digital hospital for me is, suppose for me as an admin, sitting here, I should know, I should be able to understand what is happening there without calling anyone.
Okay.
It should be available to me on my device, what I have, that how many are already gotten into the hospital, how many have got discharged, how many are into the theater, how many surgeries have been over, is there any complication there, what. So there is a whole lot of things that I need for myself, which I should be able to get it on my device without talking to anyone on the hospital. So it should be digitized such a way that I'm able to retrieve data sitting in my position.
Okay.
So likewise for any heads in that hospital areas, so they should be able to get their data, whatever they need about that hospital sitting anywhere across the world, not only here, anywhere across the world. Even I go where somewhere, I should be able to get every data on a continuous basis 24/7. So that's what I understand by a digital data. And so hospitals should be equipped in such a way that we get these data continuously.
Okay. Dr. Emmanuel.
Good afternoon, everyone, and thank you, organizers, for inviting me. I foresee in two levels, one at hospital level, another at national level.
Okay.
See, using UHID number or biobar coding, if a person's record accessed or retrieved in any hospital in India, that is digital hospital. See, it requires a lot of interfacing, medical devices, telemedicine, following ICD-10, then CPT, computerizing all information to the cloud system so that we can have a descriptive, preventive, or prescriptive analytics. Thank you.
Welcome.
So anything, if you make it available, then accessible, then affordable, at the last acceptable, that will reach the patient population and the hospital. Thank you.
Okay. Dr. Rajesh.
So as per the digitalization is concerned, technology plays the important role. In this, various technologies like artificial intelligence, cybersecurity, augmented reality, virtual reality, also in the platform of healthcare sector, which will be playing an important role in foreign countries. So which should be utilized by us as a growing country. Actually, IoT, Internet of Things, is known by everyone, but the system is moves towards Internet of Medical Things. That's comes under the platform in which smart devices for the hospitals, for the home care devices, for the healthcare platforms, which will be introduced in the sector. So we are in right track as per we are going in a way. For an example, Ayushman Bharat Digital Mission. So it was started in 21 September 2021. Within 2 years, nearly about 43 crore people were registered in that digital platform out of 144 crore of population, right? So we are in right track. So we have to introduce many things from the grown countries. That's all.
Thanks for bringing the IOMT part into the discussion. That's interesting. I'm quite surprised no one in both the panels still now mentioned in healthcare digital platform. I believe CoWIN would have been one of the amount of transactions it handled. And anyway, now I'll come to you, Rahul. You have heard all the panelists, and my question is, you have heard even Dr. Rajesh talked about Internet of Medical Things and the hardware infrastructure. Now, what is your vision in terms of as a solution provider when digital hospitals we are talking about, but how do you make those digital hospitals safe, resilient, secure? That infrastructure as a solution provider, how would you, because many of these hospital buildings would have very old electrical infrastructure, they would have fluctuating climates considering India. So those are a lot of those challenges. So how do you make them more resilient?
Thank you. Hello. Yeah. Thank you for the question.
Yes.
I think resilience has always been a number one priority for the healthcare, providers. So if you think about any hospital, the most important thing is the reliable power. Okay, we want to ensure that the power is always available inside the hospital. Now, it is easy to take it for granted, but actually we should not take it for granted about power availability in hospital. Let's take an example of a surgeon, right? A surgeon will feel confident to do an operation only when he feels that the power is always available for him and he can finish his operation on time. Okay. If the surgeon is in doubt, he will probably not do the operation in this hospital. So what we are seeing in today's time is that that we need to build that confidence for the people who are the caregivers, and we have to also build the confidence for the people who are caretakers inside the hospital. Now, we have seen that on one side, power availability is a big importance inside the hospital, and that's how resiliency has been built. But on the other side, power quality is also equally important. So we can't take it for granted that a low power quality things could be installed in the hospital building. Let me give you another example. To really protect the patient inside the hospital, we need to create layers of resiliency. Okay, and this is and we call it adding nines to the system. So let's take an example. Let's say the grid that is providing power to the hospital, it says that I'm 99% available, 99% reliable, which means 84 hours in a year, this grid is not reliable, and which is not good for the patient who is inside the hospital. Okay, it could make patient unsafe. So what do? We add a UPS to that hospital, and that adds a 9.9% to it. So it makes it 99.9% reliable. Okay, what do we do next? Because 99.9 is again not sufficient for that patient.
Exactly.
Because it is still giving back 10 more hours of unreliable power in a year. So we give another 9 by adding, let's say, power quality monitoring. Okay, it makes it 99.99. We give another 9 by adding, smart switching, which gives powers to the location where it needs the most. So it makes it 99.999. And then finally we add, all the alerts, notifications to the systems to make it nearly 100%, but still it's 99.9999%. Okay. So this is what we think is, to make hospitals resilient. This is what we think. Thank you.
Got the point. So before I come to the last round for all the panelists, just one announcement to be made that just after this panel discussion concludes, we have a felicitation ceremony where we would recognize the achievements of all the healthcare leaders who are present here. So just to inform all of you, and once we wrap up this panel discussion, we have this felicitation ceremony. Now I'll ask one specific question to each of you, separate question, and may I request, just for paucity of time, each of you to answer it in 1 minute, not take more than 1 minute. I'll start with you, Dr. Khan. You had earlier mentioned that you are coming from a relatively smaller hospital, and in the earlier panel, we also talked about the democratization of digitization which need. So smaller hospital will have its own separate set of challenges in terms of patient acquisition might not be the right word in business, but for patient coming in. So there, what role you expect digital technologies to play in terms of a relatively smaller hospital to provide improved patient care?
So improving the patient care in a small sector, I mean, it doesn't matter in whether the small sector or a bigger sector. The digitalization part definitely improves the safety, quality, and efficiency of the hospital. There is no doubt about it.
Yeah, my question was on that efficiency part.
Okay. So the efficiency definitely, because when it starts patients coming from ER,
to OR. So if it is digitalized, the flow is very seamless, and the errors made by the staffs or the doctors can be minimalized because of digitalization. And you can make more responsibility to the team.
Okay.
For instance, like the most common mistake done in any setup is when it is written or oral commands are passed around to one order from a doctor to a nurse to a technician. That's where things goes wrong. And the responsibility will not be taken care by the individuals. For example, the doctor says to the nurse and the nurse shifts the changes and it goes on. So the solution here, even in a small setup or in a bigger setup, is individually every staff or any person in the team will have an identification ID and a password separately so that they take the responsibility.
Sure.
And the communication is more clear and digitalized, and efficiency is also better.
Ultimately, the goal is to optimize that efficiency process. Dr. Venkat, my question again, 1 minute answer. You talked in the earlier point about the post-discharge. The importance of that follow-up is hardly done post-discharge, especially during the recuperative period. So how do you think an effective CRM solution, how can that improve this situation better?
So I'll definitely wind up in 1 minute because I'm hungry. Okay. So let me tell you, there are applications, okay, which are AI based today, okay, which can actually be customized to the requirement of the discharged patients. For example, they read, okay, in whichever format it is, they read the discharge summary of the patient, whether it is written by hand or through any other mode like PDF or whatever it is. The application reads it and it will customize a post-discharge plan for that particular patient with the timelines and the touch points. Say, for example, every patient, say there are 10 patients who have got their knee replacement done, okay, but there is an age which is differentiating their, prognosis. There is comorbid conditions like, diabetes or thyroid or hypertension, whatever it is. So these will change the outcome of the surgery, okay, and it may delay or fasten the prognosis of the patient post-discharge. So these applications can actually read the discharge summary, take the finer points and create a post-discharge plan for them, which will definitely be very rewarding, and the patient experience at the end of care will be much better.
Okay.
Thank you.
Thank you. Thank you. Dr. Kannan, you are very succinct in the first part, your definition and concept of a digital hospital. I have a question is, let's look at the healthcare professionals. So that would involve your doctors, your surgeons, your clinicians and nurses maybe. Now there is a challenge in sort of inculcating digital literacy among them. And there would be in earlier session, ma'am talked about the hospital staff. Yeah, that resistance is different. There is a fear of job loss and things. But in case of a doctor or a surgeon, first he would be busy to maybe, and second, again, there would be an inherent resistance to that. So how do you tackle that situation?
Thanks for asking me a question for which I would love to give an answer.
Thank you.
Our hospital is 90 years old and we have got clinicians who are in their 70s and 80s. And as you know, the resistance to digitalization increases with your age. Chronological age is the greatest enemy. I won't say chronological age, it's the mental age. You may be old, but you may be mentally young, and vice versa also. So how do you overcome this challenge among the doctors, especially towards digitalization? One is, number one, a very busy doctor, supposing he is old and is resistant, give him a physician assistant. Will take his burden. What the doctor has to say, whatever he says, the physician assistant observes, notes down, and gets the digital record. And you can give him some facilities like voice to text or even digital pens. We have provided them in our hospitals, which will enable them to write their prescription and their observation notes, signs, symptoms, management protocols in the digital pen, which will be automatically transformed into digital record. Second thing is training sessions for middle-aged younger doctors. We provide them training sessions periodically by our IT team, which is a very robust team, which gives them frequent training and tell them what to be done. And once the clinician, whatever maybe the age, get used to electronic health records, he starts loving it. Because anytime, even if the patient comes after, say, around 9 months, you can easily retrieve the entire records of the previous visits, his condition, and your decision is very quick and very accurate. So the doctor is actually impressed with this system. Once he gets used to it, only there will be initial resistance which can be easily overcome. And the last, my suggestion for improving the digital thing is digital curriculum should be introduced in all medical colleges. You know, as you all know, undergraduate education, they have introduced medical ethics recently, which is a big hit. Similarly, digital curriculum should be used in all medical colleges, in all the medical conferences, all this continuing medical education. A digital chapter should be included, which is taking place in all the recent conferences of Indian Academy of Pediatrics, etc., which is a welcome step.
Okay, thank you. Dr. Stephen, my question I asked in the previous panel also on the teleconsultation part. The teleconsultation graph showed a steep curve up during the COVID period. Now it has again, I would say, rationalized perhaps. Looking at the legal guidelines that came a couple of years back, vis-a-vis the internet connectivity across the country in relatively remote areas, taking all those factors into consideration, how do you see the future of teleconsultation and telemedicine in the overall digital landscape of hospitals?
I think you would have to look at teleconsultation in two environments. One is out of the hospital and one is within the hospital. Out of the hospital, definitely in a country like India, it will definitely help to improve access. But then teleconsultation should not just be a video call. A video call is not a teleconsultation. It should be integrated with diagnostics, with the pharmacy. There should be a follow-up. There should be
CRM.
transcription of records. All of that, of course. Within hospitals, I think it will play a larger role over the coming months or even years, where it can enable referrals. Physician to physician communication can be through teleconsultation, where it's transcribed, especially let's say it's a specialty that is not present in a particular hospital. The specialist is sitting somewhere else.
Very briefly, since you are mentioning this, I would, and if briefly, if you can answer, there is a huge security challenge even behind that, and the patient privacy thing, which is also now gradually becoming big in India. The security thing is, we all know what has been happening at AIIMS, Delhi especially. So keeping that in mind, that security part of the challenge, how do you see?
I think the software solution has to be robust. So if you look at during COVID also, no one was asking questions about security because the priority was always to get to the patient. So even a WhatsApp call was considered a teleconsultation. But for that, I think it's the solution providers who should really ensure that the security requirements are met. And of course, the government has a large role to play there with strong regulation, especially if you look at what the EU is doing in terms of data regulation, if something on a similar scale can be introduced in India.
Okay, thank you. Dr. Surendran, again, since you are coming from that, also that educational background also, and we heard about digital literacy and training to the doctors. So if you can let us know, maybe over the next 12 to 18 months, what are the plans on the anvil in fostering or inculcating the spirit of digital literacy more and actual training on the ground that is likely to happen?
Yeah, the question to him on the security aspect. When the AIIMS was hacked, our servers were also hacked. We were hacked by the ransom and we were asked for $1 million in cryptos. And we were hacked for 1 week and we couldn't operate at all. So definitely the security is a major challenge. The target were AIMS. There were 5 other hospitals who were caught in between because we were linked to their servers through the Ayushman Bharat and certain issues.
Exactly.
So indirectly we were hit. So it is not that our systems are alone has to be secure. If you are linked to some other servers to any other portal to the government or somewhere, if they are hit, we are also indirectly hit. So definitely the security is an issue. I think this is something that we have to keep in mind because we have lost a lot of medical records in that scenario. So luckily we were in the event of destroying the physical records, we didn't. So now we are in fact storing 10 years physical records in spite of having an electronic form with us right now. So this is a big challenge. As far as training the youngsters, yes, especially we have developed an app for the patient care, for education, for classes. There is a single app that everybody has. So where that app gives my patient, number of patients I have, what are those patients receiving medication that they received, the labs that have been ordered by my students, and what was the result and what they have ordered. So there is a monitoring mechanism through a form of app that we have developed.
Okay.
So I can monitor my 30 patients, what is happening to them now through that. And I can tell them, boss, this is has to be changed, don't give this. Or I have a facility to alter whatever is possible.
This monitors real time.
This monitors real time.
Okay.
So all the prescriptions, I can give it from here for my patients. I can order lab for my patients through my app from here. So this is something that we have inculcated. And also we are on the technological front now. We worked with a DNA nudge. I think all of you would have heard DNA nudge from a UK company. We are in the process of getting the DNA's mobile DNA. All of you can hear DNA pattern on your mobiles. This is something that we have envisaged, which the DNA nudge has come out with a preliminary form where you spit on the thing. The DNA is it's a PCR test right now.
Okay.
It will multiply your DNA and it'll study
There
and
is-
give a pattern of your DNA. But there are certain limitations to it right now.
Limitations, and there need to be
Need to-
certain security.
Yeah,
And-
right now with the certain diseases we can diagnose that you are potential for a diabetes or a hypertension and all that. And there is a wearable device connected to that mobile where suppose you buy buy anything in the shop, if there is there's a barcode in it, you scan the barcode, it will tell you, no, this is a high risk diet for you. This is a low risk diet for you. This is some kind of all in the preliminary form right now. So we are into the preventive aspect of it.
Okay.
Through the digitalization. This is something that envisaging. We have a lot of time to go through that. So that will be a big success in this.
Got it. Thank you. Dr. Emmanuel, again, the training part in terms of all the different stakeholders, from doctors to the administrators to the nurses to the clinicians and all the stakeholders, and they require different levels of training also. So how are you planning to ensure that?
In our hospital, we have a virtual platform. So whoever nurses come, first we'll train them for our complete cranial activity. Second level, doctors. So we have physician assistant by our another doctor. So we have physician assistant, plus some of the doctors are also been part of our training program. So there may not be a problem in that side too.
Okay. Thank you.
Thank you.
Dr. Rajesh, one key challenge in this digital transformation journey, which you are immediately facing and would like to mitigate as soon as possible?
Security problem. Cyber security is the path we have to get into the picture. Actually, in 2020-21, in USA, there is a ransom attack was happened. In that, nearly about 148 complaints registered by FBI. In that sector, it is more than the financial sector. So the hackers are targeting the healthcare industry because it is a vast area. So we have to concentrate there. And this.
It's perhaps easier to sort of
yes
take you hostage there.
Yes. We have to
The
take into
blackmailing
concentration.
potential is much higher.
Exactly.
Yeah. Okay, so Rahul, you are the last word again here. My question is, what is perhaps least touched in this digitization journey is big or small, super specialty, multi-specialty, or any hospital, they will have multiple infrastructure from buildings. The buildings will have different, then there will be a lot of chains, multiple hospitals, within hospital complexes, multiple buildings. Now, you earlier touched upon the resilience part. Now, my question is to make these buildings safer, and perhaps from a hospital administration point of view, this perhaps might not be the area that these gentlemen are looking at priority, because not because of they are not prioritizing it, but this sometimes falls out of the radar. So as a solution partner, technology partner, how would you ensure that it not only it remains on their radar on priority, but end of the day, ultimately, you help them on those missions more effectively?
Yeah. So thanks for the question again. We are a technology provider, and we are also a low voltage integrator consultant to our customers, right?
Maybe I'll add one part.
Yeah.
In the earlier panel also, that question was put, the budgetary constraints. All hospitals will have budgetary constraints, and when we talk about ROI, but ultimately that's what the expectation is from a technology solution. How do you innovatively manage the budget?
So that's a tough question, but I mean, of course, as Shweta already mentioned, we are working towards we would work towards helping our customers, create a service as a software as a service model. There are pieces where we have done that before, and I think in the future we'll do it more rigorously, considering the questions that were asked from the panels before. I think one important point here is about coming back to digitization. So what is important here is so there are so many different systems which is installed inside the hospital building. Those systems, they work differently to give a common cause, that is making sure patient is safe and making sure the things are delivered right in the hospital. But what is important from our perspective is we have to make sure that all of those systems are working together, okay, in tandem with each other. So this is what we bring, and once it is done in a particular hospital, it can be taken over to the next level, bringing it to different at the enterprise level to different hospitals as well. So digitization is a journey which we can help our customers with, and digital transformation is a need of an hour, and that's what we do from Schneider point of view.
Okay. Thank you. Thank you. We will conclude the panel discussion here. Maybe we can have a group photograph, and then we will start the felicitation ceremony. Can we have a group photo of all the panelists? Thank you. May I request Neha to just talk about the felicitation ceremony?
It is with great pleasure and a profound sense of gratitude that I, Neha Pal, Head of Healthcare and Pharma segment at APAC News Network, stand before you all today to address this esteemed gathering on the occasion of the Excellence in Healthcare felicitation ceremony. We have came together to celebrate and acknowledge the outstanding contributions of individuals who have gone above and beyond in their field of healthcare. Let this ceremony be an inspiration to all of us. Before we start with that, I would like to call on stage Ms. Sangamitra Mohanty and Gopi Krishna Arora, the co-founders and directors of APAC News Network, to please join us on stage. I would like to call on stage Ms. B. Bharati Reddy, CEO and Managing Trustee of Vijaya Group of Hospitals. Congratulations, ma'am, and we wish you all the best. Thank you so much for contributing in the healthcare sector. Can we have Dr. J. Gerard on the stage to felicitate the healthcare leaders, along with Sangamitra Mohanty and Gopi Krishna Arora? And Dr. Ravi Kumar sir as well. The next award is for Harish Manian, Group CEO, NGM Healthcare, and for that, Mr. Sundar, CIO, NGM Healthcare, is here to receive the award on his behalf. Thank you so much, sir. The next award is for Dr. Kishore CM, Vice President, Healthcare Services, Be Well Hospitals, and for that, we have Dr. Karthika Kalimuthu to receive the award on his behalf.
Thank you so much for having all of us here. While I just went out earlier, I was just having a little chit chat with ma'am, and like how today. So I'm actually the Chief Happiness Officer of Brewell Group of Hospitals, perhaps the only Chief Happiness Officer in the whole of health in India. So I was hoping and wishing maybe how we had a health tech conclave, maybe we'll have a happiness conclave in healthcare setups in future. So that's something that I wanted to share and something to ponder perhaps here.
Thank you so much, ma'am. Indeed, we will be planning something in happiness in the healthcare sector soon. Next, can I call on stage Dr. Natesh B, COO, Life and Multi-Specialty Hospitals? I'd like to call on stage Dr. M. Dinesh, Medical Superintendent, Madras Medical Mission. Can we have a huge round of applause, please? Let us celebrate all our healthcare leaders. They have gone beyond their service to serve us. Now I would like to call on stage Dr. A. Subair Khan, Managing Director, Orthovet Multi-Speciality Hospital. Congratulations, sir. Mr. Venkata Paranidhar, Group CEO, Medway Hospitals. Congratulations, sir. Let's give a huge round of applause to all the healthcare leaders present here. I think we can do a little bit of appraise to our class. I'd like to call on stage Dr. N. Kanan, Group Medical Director, Dr. Mehta Multi-Speciality Hospital, to receive the award on behalf of Sameer Mehta, sir, the Vice Chairman of Mehta's Multi-Speciality Hospital. Next, we have Dr. Stephen Matthew, COO, St. Isabel's Hospital. A huge round of applause for Dr. Stephen Matthew. I would like to call on stage Dr. Surendran P, Medical Superintendent, Sri Ramchandran Chandra Medical College and Hospital. Congratulations, sir. A huge round of applause, please. Let me call on stage Dr. C. Manuel, Director Academics and Research, Gleneagles Global Health City. Next, I would like to call on stage Dr. C. Rajesh Kumar, CEO, Venkateswara Hospitals, to receive the award on behalf of Dr. Su Thilaivalal, Managing Director of Venkateswara Hospitals. Now I'd like to call on stage Mr. Rahul Talwar, Global Segment Leader, Healthcare Schneider Electric. So please join us on stage. Let me call on stage Ms. Shweta Sharma, Segment Head, Building, Schneider Electric India. Mr. Nikhil Kumar, Healthcare Segment, Greater India Operations, Schneider Electric. I would request all the winners, and not the winners, the healthcare leaders who have just received the felicitation to please come on the stage for a group photograph, and would request all in the audience to please give a huge round of applause for all these people because they deserve it. Can I request the NHM team and the National Urban Healthcare Services team to come on the stage for a group photograph with their seniors, officials who are present here? The NHM team and the National Urban Healthcare team, please come on the stage for a group photograph. And the Schneider team as well. And after this, there's just a 5 minutes demo outside in the foyer area, and post that we'll be having the lunch. Thank you all so much for joining. The NHM team, the National Urban Healthcare team, and the Schneider team, I would request you all kindly come on the stage for a group photograph. Thank you, Chennai, for your support. We'll be taking this talk further in other states and other metropolitan cities, and hopefully soon we will be announcing our annual HealthTech event where we'll be calling all the healthcare leaders from Pan India to join us. See you next time. Thank you so much.